started feeling pain in my right shoulder and suffering a bit of weakness in there, mainly through this joint and down the sides. And it gradually got worse. It got to the point where I wasn't able to do simple things around the house. Picking up a cup of coffee became a big struggle, playing with the grandkids, doing the things I normally enjoy, mowing my lawns and riding my motorcycle, all came to a pretty abrupt halt.
WorkSafe data shows us that 1/3 of upper limb injuries occur from overstressing. Overstress injuries, similar to Ray's, include things like lifting away from the trunk, lifting things overhead, and general repetitive strain injuries with poor technique.
Rotator cuff tears, like Ray's, particularly if they're large, can progress and become irreparable if not treated early. So it's important to seek medical attention sooner rather than later. But not all rotator cuff tears require surgery. Some tears, particularly if they're small or partial thickness in nature, can be treated quite effectively with anti-inflammatory tablets, physiotherapy, or cortisone injections.
It's a depressing thing sitting at home not being able to do anything. You miss your friends at work. Work gives you sort of a purpose in life. Otherwise you're just sort of wandering around the house aimlessly with nothing to do.
A good way to test the integrity of the rotator cuff muscles is to do the empty beer can test. Now this is a test which tests the supraspinatus muscle, which is usually the first of the tendons to get torn. To do this, we bring our arm up to the horizontal at about 90 degrees, and we bring it forward about 30 degrees. Here we pretend we're holding a beer can and tip the beer can down so that it's emptying out. In this position, you try and resist a downward pressure, usually by another person, and if you're able to resist it, the tendon's intact in most cases. If you're unable to resist it due to pain or weakness, then the tendon is most likely torn.
I had the first shoulder done in November, and then I had the left shoulder done in April, and I was back to work within sort of 6 weeks, just on light duties, just helping out around the factory, doing a bit of office work, nothing too strenuous.
Thank you for coming in, Ray. Remember to do your exercises every day. Use it or lose it.
Feels really good to be back in the game again.